Hi, everyone. Hopefully, after reading the blog from the Michigan Health Endowment Fund, you are excited about planning for community engagement, whether it's for a health fund grant or for other purposes. So today in this video, I'm going to help you understand the levels of community engagement and how those influence what type of community engagement you do, the communication you have with your partners, as well as the outcomes that you can expect to achieve, and to help you feel confident in using a tool that we developed at Delaney Data Empowerment. Before we get into the meat of the material, I want to tell you a little bit about Delaney Data Empowerment. My name is Liz Delaney, and I am the founder and principal consultant with Delaney Data Empowerment, and we help you tell stories of impact. We believe that at the heart of every story your organization needs to tell is a truth found in data that can help you demonstrate your organization's impact. And so how do we do that? We do that by helping you to reinvigorate your evaluation practices, to discover the true value of your data, and to retool any sort of evaluation capacity needs that you might have. So let's get into it. Uh, as most of you know, probably better than I, there is, a project cycle. And so this is going to be pretty project specific. However, I do think this can be applied to any sort of program project, even potentially policy interventions and collaborations. But essentially, you identify needs and assets. You then use those needs and assets to develop activities. Those activities are then used to identify how you're going to assess the effectiveness of those activities. And then that evaluation or assessment of effectiveness is used to adapt programming. And what I'm hoping to help you understand today is that through all parts of that process, the project cycle, the community can be engaged. And so in identifying needs, they can be asked, what are your needs? Or even better, maybe a community organization gets together and they decide what the needs in the community are without even being prompted. There's also an opportunity to ask folks what they want to see as far as activities that they can do to address those particular needs. Then there's the sense making, meaning making about what is effective and what does that effectiveness mean related to programming. And so at all stages of the project cycle, you can engage community. And if you read anything about community engagement, you've probably seen something similar to this diagram. And we actually used a couple different sources for this, which will be listed in the tools as well as in the next slide, actually. And I think what's important about what we pulled from these different sources is the idea that, on the very top, there's different ways that you can engage with community. So there's the outreach way, which is really just kind of flowing information from you to the community, telling the community, we're going to do this program, or we identified these needs. At the next level, the communication is really about, getting information back after you share. So we identified these needs in the community. What do you think? The next level is bi-directional, where you are asking community what their needs are, they are telling you, and or they are in the empowerment one, they're actually coming to you and saying, this is what we need. And you are there more as a consultant or someone to facilitate the discussion rather than as the one that has started the discussion. And so as you're thinking about how you want to engage community during the different parts of the project process, I think it's important to be clear about where you're hoping to engage community on this continuum, but also what are any constraints that you might have that would keep you from getting all the way to empowerment? Is your board bought into this process? Are they okay helping to support your organization, helping to support whatever the community identifies, or are there going to be some limitations? Or did you find a really great grant opportunity that has a very specific focus? And so you're not going to open the question up so broadly. It does have to have a little bit more of a focus. And so just being really clear about where you're at on this continuum helps you make sure that you are being respectful of community's time, planful about how you engage community, and actually able to act on whatever you're proposing to the community or they propose to you. So with that, we developed this tool at Delaney Data Empowerment. And I did want to acknowledge that, of course, I did not develop this all by myself. I did put together this particular tool, but it's, been a number of years in conversations with a number of partners through the Health Fund and others throughout my career, as well as these particular resources. And you'll notice that the K-Connect community engagement compensation structure is also linked in this tool. And so that's a really great resource that I'm hoping you will go ahead and check out. So with that, I'm going to walk you through an example. So there is a program. I sort of made up this program of, it's currently serves or an organization that serves returning citizens. And they started to realize through those that work in the organization who are also returning citizens themselves that there's really a disconnect between when people are receiving medical services once they return back to their communities. And the disconnect is really resulting in premature death, in overdose, and really people waiting too long to receive medical services. And they wanted to dig into this problem. And so the first question on here is who is or are your community members? And in this case, it's returning citizens, and we're also going to talk about medical providers. And the reason that we're including medical providers is because some of the folks that work in this organization, again, who are also returning citizens, said, that when they were in prison, they had a poor relationship with medical providers, or they felt like sometimes their needs were not addressed in a timely manner, things like that. And so we also want to get a perspective from the medical providers that are providing services once the citizens have returned to community. And so in the needs statement, you are first going to identify what type of engagement you want to have with the community. And so this goes back to that continuum I showed on the last couple slides. And so this, again, is just being really planful about what level of engagement you're going to use. And in this particular case, we're both going to share the needs that we identified and ask for confirmation. That's specific for the medical providers. And we're going to ask community with a particular focus that's specific for returning citizens. Now, if for some reason you decided not to engage in community for the need statement, you would just select no engagement, and then you skip the rest of these questions. But in this case, and I strongly suggest if you're able to engage community along the entire planning of a program or project. And so then you list why the type of community engagement, that's the type of community engagement you're going to use. And if there's a particular focus, say why. And in this case, we decided to have a particular focus, even with our returning citizens that work in our office, because we found an RFP that we wanted to apply to. And so given that type of community engagement, how will we know if we have a quality needs assessment that has really used that type of community engagement is what is in this last box in that column. And we think that a quality community or a quality needs statement is going to resonate with both communities. It's going to show need, and it's going to focus on systemic issues, and if possible, root causes, and not necessarily putting the blame on either the medical providers or the returning citizens. And so then in the next table, we look at, who are you going to ask is the first column, and then how you're going to plan to invite them, and how do you ensure that you have consent to share their feedback. So making sure that you are informing them what you plan to do with this, as well as, we'll get to that last column, how you're going to report back. How are you going to ask community, and how are you going to document their responses? So getting a little bit into sort of that evaluation or participatory evaluation component. Are you going to do stickies around the room? Are you doing surveys? Are you doing some focus groups? How are you going to compensate the community for their time and expertise? And this is where it would be great to look at that, the K Connects compensation report. This is all based on the type of engagement that you're asking community to have, and sort of their roles within the project. So in this particular case, both the medical providers and returning citizens are actually paid through their jobs to participate in this. So it's not necessary in this part of the example to have any sort of compensation for the returning citizens that work at our office and the medical providers. And then, of course, you have to think about how you're going to report back on what you learned to make sure that what you are providing reflects what the story that they are telling. And then in the next slide, we actually go through the program, initiative, or intervention development. And in this one, you'll see it's the same questions in the orange boxes, essentially the same questions up in the blue boxes. But you will see in this one that we added recent graduates of our program as one of the audience members versus our staff. So the recent graduates are also returning citizens, but they don't necessarily work with our organization. We're going to ask them to participate in focus groups for up to an hour and a half. And we're going to provide them $50 gift card, childcare and food, and then also offer them bus cards. So, and then, we're going to share the final program plan with the graduates over email or mail. And something important to discuss at this level too, once you are actually in the planning, is do the graduates want to participate in programming, or does it not make sense for that to happen? And would it just be, the current staff of the organization as well as the medical providers? And then the third slide actually gets into evaluation and learning. I think a lot of times in evaluation and learning, an outside source is saying what is valuable and what we want to see change, but there's a real opportunity using community engagement to ask community, what does a change look like that, would help you reach your goals? And so I think that you can do some evaluation and learning planning with people from the community that have lived experience. And so in this case, we would ask some recent graduates who expressed interest in program planning to participate in learning and evaluation work. They would work in group meetings. Maybe we have like a work group, and then they would actually get paid for their participation in these work group meetings quarterly through the life of the grant, at least the life of the grant, perhaps beyond that. And they're going to receive a summary after each meeting. Of course, staff are also going to participate, and the medical providers as well. And the one other thing that I linked to at the bottom of this page is an evaluation plan resource that we put together a while ago, as well as a fillable template. Those are available through Google, but one is in a PDF and the other one is in a PowerPoint. So if you have any questions, please feel free to reach out to us. We would be happy to help you with any evaluation planning or even thinking through how you can best engage with community. And I hope you have a great one. Thanks for stopping by.